Origins of cystic fibrosis lung disease. Definition: cystic fibrosis is a genetic disorder that affects mostly the lungs, but also the pancreas, liver, kidneys, and intestine. Long-term issues include difficult breathing and coughing up mucus as a result of frequent lung infections. Other signs and symptoms may include sinus infections, poor growth, fatty stool, clubbing of the fingers and toes, and infertility in most males. Signs and symptoms: copious phlegm production, decreased ability to exercise, bronchiectasis, hemoptysis, and hypoxia, pulmonary hypertension, and heart failure.
Cystic fibrosis, or CF, is a genetic disease that affects multiple organs, including your lungs, and limits your ability to breathe over time. Your main airway, called the trachea, branches into each of your lungs. The largest airway within each lung is called a bronchus, and each bronchus branches into smaller airways called bronchioles. Normally, airways are coated inside with a thin layer of fluid and mucus. The mucus catches dust and germs from the air you breathe in. Then, hair-like projections on the airway surface, called cilia, push the mucus, trap dust, and germs out of the lungs. In cystic fibrosis, the mucus is so thick and sticky that the cilia can't push it out of your lungs. This thick, sticky mucus can build up, trap germs like bacteria, and block your airways. Because of this, you may periodically have acute infections or exacerbations of the disease, causing symptoms such as increased coughing, production of mucus, and shortness of breath. As the disease progresses, long-term damage can occur in your lungs. This happens when germs, like bacteria, get into your lungs and cause chronic infections and inflammation. But there's a lot you can do to control the infections and slow the progression of lung damage. Talk to your CF care team about how the different parts of your treatment plan can help keep you healthier. As your partner, they can help you find ways to fit your treatments into your daily care routine.
Applications on medicine. The FDA approved Trikafta, the first triple combination therapy available to treat patients with the most common cystic fibrosis mutation. Trikafta. Trikafta is approved for patients 12 years and older with cystic fibrosis who have at least one of F508del mutation in the cystic fibrosis transmembranous conductance regulator gene, which is estimated to represent 90% of the cystic fibrosis population.
A patient with cystic fibrosis is susceptible to infections of the lungs. This is due to a mutation that affects a protein on the surface of lung cells. Many different mutations can cause cystic fibrosis, but all of them involve a transmembrane protein called CFTR that functions as a channel for chloride to move in and out of cells. In this case, CFTR is less able to transfer chloride ions out of the cell compared to the functioning protein in people without cystic fibrosis. The channel is, in effect, locked shut. This inability to transfer chloride ions has an effect on the outside of the cell. In people without cystic fibrosis, there is a balance of chloride ions inside and outside lung cells, which maintains the right amount of water and salt ions in the mucus lining the airways. Cilia normally sweep the watery mucus from the lung lining, keeping the surface clean. In patients with cystic fibrosis, chloride ions concentrate inside cells and draw in water by osmosis. With less water, the mucus becomes thicker and cilia can't move. Flow is reduced, providing an environment for bacterial infection. But there are now drugs that can help patients. To find a drug, researchers tested over 200,000 small molecules to see if any would bind to the CFTR protein. Then, for each small molecule that had some binding ability, researchers chemically synthesized different variations of that molecule and tested them for the ability to improve the function of some types of mutant CFTR channels. They identified a drug that, when taken by patients with a certain type of CFTR mutation, binds to the CFTR protein, opening the channel and allowing improved ion transfer. This increases chloride ion flow and maintains a watery, clear mucus, which helps the cilia move more freely and reduces the risk of bacterial infection.
Pros and cons. Pros. It has screening and genetic tests. Treatment can ease symptoms and reduce complications. And it has many options for treatment. With a good care, you can prevent and control infections that occur in the lungs, remove and lose mucus from the lungs, treat and prevent intestinal blockage, and provide adequate nutrition. Cons. There is no cure for cystic fibrosis, and managing cystic fibrosis is complex.
In cystic fibrosis, thick, sticky mucus presses down on cilia inside the lungs, preventing the cilia from beating and clearing the mucus. The cause of this problem is an abnormal CFTR protein created from genetic mutations inside the cell nucleus. Our goal is to replace and repair the abnormal DNA sequence to create a functional protein and restore normal mucus. One way to do this is to use gene editing technologies that cut out and replace defective parts of DNA, such as CRISPR-Cas9. The CRISPR-Cas9 repair system has three components: a guide RNA that seeks out and binds to a specific location in the DNA, the Cas9 nuclease enzyme, a type of molecular scissors that cuts the genetic sequence at the precise binding site, and a repair template containing the correct genetic sequence for the gene. Once these three components are introduced into the cell, the guide RNA binds to and activates the Cas9 nuclease. Now, the Cas9 nuclease, the molecular scissors, can search the cell's DNA for potential targets. At a potential target site, like the one shown here, Cas9 unwinds a section of DNA to see if the guide RNA sequence matches. If the DNA sequence matches the guide RNA, the Cas9 nuclease cuts the DNA to create a break in the strands. To replace the mutation with a normal sequence, a repair process is used that precisely edits the DNA. For this editing process to work, a short piece of DNA template that contains the desired normal gene sequence is introduced into the cell. The cell uses this fragment as a template and copies the new sequence as it repairs the broken DNA. Once the first strand has been repaired, the template falls away, and the other strand of DNA uses the repaired strand to fill in the remaining gap, leaving both strands with the corrected gene sequence. The cell then uses the corrected DNA strand to produce a functional CFTR protein that allows the proper flow of salt and fluids through the cell membrane.
Mucus returns to normal within the lung, allowing the cilia to beat freely and clear the lungs of germs and irritants.
Issue applied in Ecuador. Cystic fibrosis in Ecuador. In Ecuador, it's estimated that 1 in 1,100 252 live births, 99 new cases per year has cystic fibrosis, a genetic disease without a cure and without lifetime treatment. Changes. Since 2010, the state, through the Ministry of Health, delivers free of charge all the necessary medication to cope with the pathology.
So we've just completed our phase 2 program, and it shows very important signals for reduction in pulmonary exacerbations in patients with CF. We're beginning the planning process now, working with our advisors, very importantly working with the Cystic Fibrosis Foundation, to get our regulatory submission together for both the European Union and the US Food and Drug Administration to get their concordance on what phase 3 program would look like. We will be focusing on patients with milder disease to try and interdict that overheated immune response to slow down the long-term damage that's associated with too much inflammation, the cystic fibrosis. And our primary outcome will likely be pulmonary exacerbations. This will be the first anti-inflammatory that's studying pulmonary exacerbations in a phase 3 registration trial. So we're pretty excited about having that dialogue with the FDA, EMEA, and we target starting the trial sometime in the second half of 2019. So cystic fibrosis patients are very susceptible to pulmonary exacerbations. Pulmonary exacerbations are a situation where a patient's infection and inflammation get so overheated that they ultimately require rescue medication. That rescue medication is often very heavy doses of steroids, which is not healthy to use on a long-term basis. They also require new antibiotic therapy to kind of calm that bacterial infection that's gotten overheated. And in many cases, patients wind up in the hospital. And that's not just a big clinical outcome, a bad outcome, because you can imagine patients with CF are students, they're professionals like you and I, and 3 weeks in the hospital with permanent lung damage as a consequence of the end of that 3 weeks is not really a good outcome. And unfortunately, with the best care in the world today, patients still exhibit pulmonary exacerbations. And the beauty of our phase 2 program with aspilostat is that by adding once daily aspilostat into a patient's current treatment regimen, we can decrease the number of pulmonary exacerbations they have on an annual basis. That has good clinical consequences, prolonging lung life. That has good cost effectiveness consequences, because as you can imagine, a pulmonary exacerbation that requires hospitalization is very expensive. In fact, a severe pulmonary exacerbation costs the healthcare system $120,000 per patient per episode. And so by reducing exacerbations with aspilostat, we can improve lung life by reducing damage from overheated inflammation. We can also potentially reduce overall cost of care for patients with cystic fibrosis by keeping them out of the hospital or the acute care setting.
Conclusion. Cystic fibrosis is a hereditary disease that affects the lungs and digestive system. The median predicted age of survival for people with CF is currently in the early 40s. Life expectancy is strongly affected by the severity of the disease, age of diagnosis, and the type of CF gene mutation. With routine therapies and healthful lifestyles, most people with CF can lead active lives.
My name is Samantha Hembry. I'm 25 years old. I'm a single mom, and I have a 3-year-old beautiful little girl. Her name is Shaylee Rain, and she has cystic fibrosis. When Shaylee was born, she didn't want to eat. At 8 days old, whenever we found out Shaylee had CF, I couldn't have told you much about it. It is a very rare disease. It only affects 30,000 people in the United States, 70,000 worldwide. It's classified as a chronic lung disease, but it also affects anywhere that your body naturally produces mucus. So that's going to cause problems, mainly in the lungs. It also affects her pancreas, her liver, the GI tract, the reproductive organs, and her nasal cavities. In all, she's had 3 hospital stays and 2 tune-up surgeries. From day one, we have to get up an hour just to do her treatment. Her vest is really loud. She doesn't like that. That is the one thing that bothers her. Now when we do treatment, as soon as we put on her vest, Mom, is it over? Mom, is it over? Are we done yet? Are we there yet? Do you like doing your treatment? Nope. No, why not?
It makes me crazy.
Makes you crazy. What superhero are you today? Shaylee, she loves playing outside. Loves playing outside. I cannot keep her from being outside.
I want this one.
She also loves to color. It doesn't matter if it's crayons. It doesn't matter if it's markers, dry erase markers, painting. What are you drawing?
Puppy.
A puppy. One of the saddest things with cystic fibrosis is you cannot go within 10 feet of someone else's CF without PPE, without personal protective equipment. And the one person I would want to talk to is somebody who was going through the same thing I was. This is Shaylee's medicine cabinet. Shaylee is on, probably 12 to 15 medications / treatments. She knows that she has to take medicine before she eats. She'll say medicine first. She takes 6 pills with every meal, 3 with snacks. That's all day, every day. So that adds up to 20, sometimes 30 pills a day. She's had to take these medicines, she's had to take these pills, and she's had to do these treatments, and she really doesn't know any other way. But now at 3, she says, Mom, this is yucky, and I don't like it. I know, that's a yucky one, huh? I don't ask too many questions about what is it going to be like when she's 5, what is it going to be like when she's 10, because medicine, it's come so far and it has a long way to go. To anyone watching this video, whether you're just learning what cystic fibrosis is, or maybe you have a CF kid just like me at home, stay positive, stay optimistic. Tomorrow is very bright for us and for all the other CF kids. The way medicine keeps changing, they're going to have a medicine for her, and then the next day they're going to have a cure. Yes.